And welcome back. Well, one of the largest social service organizations in the state is right here in southeast Wisconsin.
Children's Hospital of Wisconsin provides care throughout the community, reaching nearly 200,000 children. And here to tell us more about their breadth of services is their COO, Dr. Marc Gorelick. Great to meet you this morning.
Thank you. Thanks for having me.
In fact, the largest social service organization in the state.
That's right.
Right? How do you feel about the ranking that you have here in Wisconsin in a fairly small city when you consider other states, for Milwaukee to have such an incredible organization such as yours?
Yeah, we are one of the top-ranked children's hospitals in the country. And if you look at those top-ranked children's hospitals, we're in the smallest market. We're a little bit like the Packers that way, right?
Yeah.
Great team in a small market. And like the Packers, the reason we're able to do it is because of the great support that we get from the community.
And how do those rankings come about? Is it because you have great doctors, great outcomes? What gives you that standing?
It's really all of that. You know, the things that those rankings look at are first and foremost the quality of care you provide. What are your outcomes? What services do you have? What's the breadth of services? We have over 500 specialists on our staff, and we can provide every specialty imaginable. And we do it with great outcomes.
Yeah.
I didn't realize that Children's was started as a philanthropic effort from volunteers 100 years ago.
Yeah, we've been part of this community for over 120 years. So in 1894, a group of community volunteers realized that children weren't just small adults, and that their needs weren't being met by the institutions in the community that were focused on adults. The best way for kids to get what they needed was having an organization that was 100% focused on kids and understood their unique social and medical needs. And so these 7 women from the community got a little house on Brady Street and started what was then the Milwaukee Children's Hospital. That has grown into what we have today.
I didn't know that part of your history. I agree, it's incredible. And the numbers, when you take a look, make the point that you're having a huge impact. For example, there's 60,000 ER visits. Is that in a year?
That's in a year.
In a year.
We're actually even though we only see kids, we're one of the busiest emergency departments in the state.
I've been there a few times with my kids and always had wonderful care and great outcomes. You also have 12,000 surgeries in a year.
That's right.
And 200,000 kids are impacted by your community service. And this is the arm of Children's Hospital I was not familiar with. It was the ways in which you reach out into our communities.
Yeah, and Children's is in many ways unique in that regard. Our vision is that the kids in Wisconsin will be the healthiest in the country. And so that takes great medical care when they're sick, but it also takes doing things to keep them well and understanding the other determinants of health and addressing them. And we do that through our community services arm and then in partnership with others. So we have school nurses, for example. We have foster care and adoption services, the only children's hospital in the country that does that. We have child counseling, child advocacy, all of those services in many communities, not just in Milwaukee, but really throughout the state of Wisconsin.
You know, I often think of hospitals being kind of the self-contained financial institute, but donors play a huge part in Children's and its operation, right?
It is absolutely critical. So again, our vision is the kids are the healthiest in the country. That's all the kids of Wisconsin, and much of our care is for those most vulnerable kids. For example, more than half of our patients are covered by Medicaid. Now, in some of our clinics, it's 90%.
Wow.
Now, Medicaid's a great way to provide insurance for those without means, but it doesn't even pay the cost of care. So the only way that we can sustain that is by supplementing that with philanthropic support from the community, from those others who share our vision of those healthiest kids.
And a lot of those kids are long-term residents at the hospital, right? They're staying for longer-term care.
That's right. Some of them are there for clinic visits, but many of them do spend a significant amount of time in the hospital because of their special needs.
It's fascinating, too, that a city like Milwaukee is leading the way with some of the ways in which you help our community and reach out beyond the hospital.
Yeah, we've done some unique things. We have partnered with other organizations, with the Sojourner Family Peace Center, for example, shelter for battered women, but also brings together our child advocacy services, police services, and so on, counseling, violence prevention into one location. That's a unique model in this country that we've been able to do by partnering with other community organizations, and again with huge philanthropic support from the community for that effort.
And also didn't realize you had a connection to foster care and adoption.
Yeah, so we provide foster care services and adoption services for many of the counties in the state of Wisconsin. And again, the only children's hospital in the country that does that. So really something quite special.
Yeah. How has working with Children's changed your life?
You know, I've been in pediatric healthcare my whole career, and you know, children are our future, and it is challenging to deal with kids when they're sick, but it is so rewarding. There's nothing like seeing a kid get better.
Yeah,
That is
that
wonderful.
resilience that they have, too.
Absolutely.
Well, people can give and can donate to Children's Hospital. Those donations truly are necessary. Children's Hospital of Wisconsin, here's how you can do that. Donate today by visiting chw.org/give. You can also text the word kids to 56512. When you do that, do you have to pronounce a dollar amount that you want to give? Do you know?
I'm not sure.
Okay, so if you text that, you'll get more prompts. You'll figure out how that works, but you can donate as well by going on the website and finding the link to donate today as well.
And
Thanks
it's
so
in
much,
all
Mark.
of our interest, I think, to support
Yeah.
Children's Hospital, to keep a hospital of this caliber in our community, because you never know when a child you love who's in your life is going to need the services there.
Well, we touch many, many lives, and we're an indispensable part of the community. And again, we couldn't do it without the support of the community.
Yeah.
We appreciate
Thanks
you
for being here.
being here. Happy holidays to
Thank you.
Thank you.